All right. So, welcome to everybody. This is the July 8th, 2026 edition of Topics in Trauma Nursing. I'm glad you guys are all here and able to join us tonight live. Those of you that are watching this up on YouTube, thanks for joining us in the virtual environment. Greatly appreciated. And we've got a great topic tonight. We're going to be talking about e-scooters, e-bikes, and micromobility devices are coming or probably have already been at an ED near you at this point in time. And we've got a great guy to talk about it. I'll let him introduce himself in just a minute. I'm going to go through a couple of housekeeping rules here real quick. All right, so I think everybody on this call has been to a Topics in Trauma Nursing in the past, but if you haven't, it's a quasi quarterly educational offering that I came up with to bring hot topics in both trauma and emergency care to nurses, at least initially in New Jersey, because that's where we are all epicentered from. But we've got a contingency of about maybe 25 or 30 nurses, particularly on the YouTube channel, that are across the country and international. So that's always kind of cool to see. So it is New Jersey and beyond. The goal is really to sit back, enjoy, do ask questions. We do want there to be some level of interactivity here. It's great that we're able to do this in a virtual environment, but one of the drawbacks of the virtual environment, unfortunately, is sometimes we're not as interactive as we are when we're sitting in a lecture room together. So please, feel free to put some questions in the chat box, or at the end we'll have a little bit of we'll have some time to ask questions of Rod. So please, you can unmute yourself at that time and ask your question in live if you'd like to. The other thing is recruit more nurses for the next session. When toward the end, I'll flash a QR code as well as put a link in the chat box for you to go and provide an evaluation for tonight. You can claim up to one CE credit for participating in the live session only tonight. And you'll have an opportunity to give some feedback about some additional topics you'd like to see. If you yourself would like to present and you're bold enough to want to go down that road, then I'd like to hear from you for that, because I really like to bring people on and have other people talk other than me doing a lot of the presenting for these talks. And then ultimately recruit some additional people, recruit from within your departments and across the ranks, and you can turn them over to the YouTube channel, have them look for me at the Trauma Geek. And after tonight, we'll have about 34 different videos up there with a cross-ranging topics, mostly on trauma, but trauma and emergency care, and some pre-hospital topics as well, if you are so inclined. And again, all these sessions are recorded and they are all going on YouTube. And typically what I will do is once we get these rendered and I get them posted up there, I'll send a link out to everyone who participated. And even for those who signed up and couldn't be here tonight, I'll send the link out, and that way they can join virtually, because we know life happens. And then ultimately you can pass that link on to colleagues if you think they might be interested in the content tonight. As I mentioned, we're going to give an hour of credit for those of you attending tonight's live session. And again, I'll put a QR code up at the end and put a link in the chat box, and you will be able to do that. All right, a couple of shout outs as I usually do with some other education that's going on, particularly in the realm of Emergency Nurses Association. We've got the big meeting coming up, so registration has been open for quite some time for Emergency Nursing 2026. It's in Phoenix, Arizona. Yeah, not probably the destination capital of the world to go to. But if you like the desert, if you like warm weather, and you like looking at Big Red Rocks, which is like just outside of the Phoenix area, it would be a trip that'll be good for you. But more ardently, it's a great opportunity to get together and network with like-minded colleagues from around the world. It's the largest individual meeting for emergency nurses in the world, and the topics are great, and the collegiability is great. So if you have an opportunity and you want to go, I wholeheartedly recommend you go to ena.org, and there's great information on ENA's website with regards to that. More personal is our New Jersey ENA annual conference, which is the second largest emergency nursing conference in the country. We have about 500 attendees at this every year. It's down at the Hard Rock Hotel and Casino in Atlantic City. The 47th annual conference is already being planned from March 17th through the 19th of, that should say 2027, not 2026, by the way. And we'll be back down at the Hard Rock Cafe in Atlantic City. It is an excellent conference, and I wholeheartedly, again, recommend, if you can't go to the national, go to the state. If you can go to both, that's even better. All right. Boom. All right. So I'm going to let Rod introduce himself. What I try to do is get a little bit of a cross section of images up here to try to capture the personality of our speaker that we've got. So, Rod, I've got a little bit of a cross section for you. For those of you that know Rod, you know, in addition to being a great emergency nurse and a leader, he also has dabbled a little bit in the pre-hospital environment, which I'm particularly fond of. So, Rod, just introduce yourself and tell us a little bit about yourself, and we'll get into the talk.
So thank you, Steve. And it looks like you've been going through the internet trying to look for some old photos. So my name is Gerard, but everybody calls me Rod. I don't know, it's a German thing. And I'm primarily consider myself a paramedic. But for the last 12 years or so, I've been a nurse. And for the last 7 years, I've been the administrative director of the emergency department at Trinitas Regional Medical Center in Elizabeth, New Jersey, which is now part of the RWJ Barnabas system. And I've worked for several healthcare systems throughout the state of New Jersey as part of my career.
Great. Well, it's great to have you here. And I've heard Rod talk on a number of occasions in the past. He's a great speaker, and I've heard this talk in particular. He gave it just a few weeks ago at the Northern New Jersey Summer Conference up at St. Joe's Wayne Hospital, and did a great job. So, you
And,
know,
and you mentioned you wanted people to possibly be speakers. You know, the secret that I've learned is you don't have to be really an expert on it. You have to just have an interest. So if there's a topic you're interested in, like I was interested to know about the cannabis dispensary close to our hospital, how it would affect us, just learn about it, get the data. You're a nurse, create a program, get CEUs and issued, and you're good to go. And it's really been very beneficial to be able to be a speaker, not only for the ENA, but for other organizations.
yeah,
And
great
now
plug.
doing my first podcast.
You are. So we're elevating you. Okay. And Rod's straight on. You know what? It doesn't take it's not at all hard to be a speaker. All right. You don't have to be nervous about it. Generally speaking, once you start looking at a topic in more detail and you start putting slides together and you go over those slides ad nauseum in your sleep and keep retweaking them, you really do become very well versed in being able to speak on them. So for any of you that are out there that have a topic of interest and you think you might want to use this as a springing board to get out there and get yourself known as a speaker, please reach out to me and let me know. All right. So without further ado, I mean, this topic is certainly, I think, near and dear to all of our hearts. It doesn't make any difference whether you work in a trauma center, whether you work in just a general emergency department. We are seeing patients that are coming in after being injured on these micromobility devices. So it's a very timely topic, particularly with new laws that are going into effect in a little over a week, I believe, or a week and a half. So
Yeah,
it's a
eight
very
days.
timely topic. So, Rod, I'll let you go.
E-scooters, e-bikes, and MMDs, micromobility devices. They're already at your ER, but the topic is coming to an ER near you. Please advance to the next slide. So the outline of the program, at first we're going to talk about the devices. We're going to talk about some case studies about each device, trauma resulting from accidents from these devices, the reason why there's so many injuries as opposed to regular bicycles or scooters, high speed, inadequate protective gear, and then what to do with bikes when they come to your ER with patients. That's been a problem that I've encountered, especially when they're damaged. What do you do if the battery's damaged? What if you do if they're leaking gasoline? If they're motorized? Where do you store them? And I don't necessarily have all the answers to these things. Of interest is the fact that when I originally gave this lecture, It wasn't as timely as it is now because the laws that go into effect, the laws go that were in effect are changing in about 8 days in New Jersey. We'll discuss those laws. And also, we'll talk about helmets and what type of helmets are best for e-bikes. And then finally, I'd like to talk, don't be a hater. Like, don't hate all these devices. There's positives to them. Our our patients, our clients are using them, our staff are using them, and maybe we need to adjust to how we can safely encourage our staff to use these devices. Next slide, please. So the objectives, so that you can get your CEUs, you'll be able to verbalize the hazards related to these devices, especially amongst those that are very young or very old. You'll be able to identify the injuries that are suspected due to the higher speeds. And we'll talk about what high speed means on an e-bike. And finally, we'll summarize the hazards, benefits, and other uses when e-bikes and e-scooters are used by hospital employees to commute to and from work. Next slide, please. So, as an introduction, PTDs, personal transportation devices, they're now a routine part of your emergency department volume. You're seeing them on all your, but more so during the warmer weather and in the evenings. Also, because there's a rise in the use of these e-bikes, e-scooters, and MMDs. You see higher injuries at lower speeds. So just because an e-bike is doing 20 miles an hour, don't think that's a low speed injury. Consider a high speed. We'll talk about that. And also how, as an emergency department nurse, understanding these sources of transportation uh, is important for you when you in order to recognize, stabilize, and treat your trauma patients. Next slide, please. So clearly these pictures are generated by AI, but they may look happy, but the way they are using them in these proposed pictures is very dangerous. It looks really very nice, but it's extremely unsafe for many reasons. Obviously, they don't have helmets, they don't have protective gear, but having a child on a e-scooter, you fall off the bike and fall on top of the child. Clearly, that's um, causes a significant trauma to the child. Next slide, please. So think of not only our clients, our customers, our patients as being victims, but I have employees that are using e-scooters coming to work and e-bikes coming to work, not and motorcycles. We're always concerned about the nurse riding a motorcycle, but we need to be concerned about the nurses that are using these devices, particularly when they're not wearing helmets, of all things. Next slide, please. So I'm not only a topic presenter on e-bikes, I'm an e-bike user. During COVID, I went out and bought an e-bike. And how do you buy an e-bike? Well, back then, you just went onto the internet and bought one from China and waited for it to be delivered. As you can see, I had to put a few parts together, and I'm not very mechanically inclined, but even I was able to assemble it safely. And I used it primarily for not only exercise, but transportation, but more so to make exercising on a bike more interesting. So on an e-bike, it's not, you can use all throttle, but at the most part, you can set what percentage of pedaling goes towards the speed, so you can use it. And instead, in giving the same amount of effort to ride my bike, that's a road bike, and go 10 miles an hour, I can use that same level of effort and go 20 miles an hour with an e-bike. So it makes it a lot more interesting and a lot more fun to ride. Next slide. So as I mentioned, um, in COVID, I used it. The trails by me were closed. Um, and also people were really worried. Now, I'm obviously being a little dramatic here, wearing the P100 mask, riding my e-bike, but I just did it for the effect of the picture. But um, people were out there on the trail with masks on during COVID. Next slide. And an interesting story that I wanted to tell you about is one day I was riding my e-bike, and I live on top of a hill. I live on Schooley's Mountain, which is about 1,000 foot elevation. And so the problem with living on top of the hill is it's great for riding my bike. I ride downhill to go to the trail. I ride this old railroad trail across town. And at the end, I got to ride it back uphill. So I found this uphill section that is a dirt road along a river that is very heavily wooded. And so it's a great place to go uphill because it's a little cooler. There's not as many cars. So one day I was riding my bike, and there was a mountain bike race going on, and they were going up the hill just as I was coming by with my e-bike. And I've had problems with the e-bike too. The hill is going up my mountain is so steep that if I'm not careful, I can overheat the engine. So I'm going up the hill and I'm passing all these people in this race, and they're yelling at me, "That's not fair." You can imagine they're probably almost spitting at me. And all I could think of is, God, please don't overheat this engine. And then I have to walk up the hill, and then they'll all be passing me, and then they'll be cursing at me. So next slide, please. But the catalyst for me making this lecture is one day I was outside my emergency department, and I took this picture. I didn't take it fast enough, but you can see the keep right sign. But just to the left of the keep right sign, there's a woman. There you go. And she is riding a e-scooter, and she has a child on the front of it, much like the picture that I presented earlier. And I'm like, right in front of my ER, really? That's so dangerous. So that really was my inspiration for this presentation. So let's talk about the different devices. So first I want to talk about e-scooters. Next slide. So the way I'm going to talk about each device is to do a case study. So all these case studies, by the way, are loosely based on true patients that we either saw in our emergency department, or in one case was a local injury. But in this case, someone came to our ER, 40-year-old woman, low impacts e-scooter accident. Actually, this was a male. The initial impression was that it was just minor trauma and that the patient had a seizure and fell off their scooter. EMS evaluated the patient, determined that there was altered level of consciousness after reported of a seizure. The assumption from the people that were on the scene was that it must be drug related or alcohol related, because the guy was going very slow, hit the curb, seemed to come off the curb slowly, and then fall to the ground and then have a seizure. Patient arrived at the emergency department unconscious. Um, EMS stated that the patient had left home to go to the corner store using his e-bike. It wasn't very far. As a result, he didn't have a helmet on. He didn't have any gear on. He was just going to the corner store quickly. Witnesses state that he hit the curb and fell. And as I mentioned, he must be high because he stumbled and fell when he fell off the scooter. Next slide. So there was no signs of external trauma on initial assessment, no facial or head trauma. Patient was not wearing any protective gear, as I said, no helmet. And then on the scene, initially, the e-scooter was on the street, meant no damage to the vehicle, no significant bleeding or deformities. Patient was unresponsive, but was breathing initially. As I stated earlier, witnesses on the scene said that there was a brief seizure. Pre-hospital assessment, their ABCDE. He had a Glasgow Coma scale of 6, primarily because of the irregular, slow respirations. Blood pressure initially was very high, as you can see, and the heart rate was high. So we're thinking head injury Loss of consciousness, level of consciousness was decreased. Pupils were unequal and sluggish, also pointing to a head injury. No external trauma was noted, though. Nothing on the head, the neck, or the torso. Next slide, please. The patient primary impression that it was possible postictal state in either they had from the seizure or intracranial event. Most likely, I would think intracranial event with the other signs. Actions taken: he was put on oxygen, he was intubated with RSI. Um, we elevated his head, put him in C-spine, maintained C-spine precaution, started IVs. He got a CAT scan, and the CAT scan showed a massive intercerebral hemorrhage with a midline shift. Major injury, major concern. We're not a trauma center at our hospital, so he had to be transported out. So the trauma center that received him did a second CAT scan. They confirmed the diagnosis of the first one, severe traumatic brain injury with herniation. So that's how severe it was. But there was no skull fracture or any contusions present. So likely there was a coup contra coup injury as a result of the sudden de-escalation from hitting the curb. He went to had a neurosurgery consult. He got the ICP management. He went to the traumatic ICU, admitted to ICU under trauma, and his prognosis initially was guarded. And they felt that his possible seizure was induced by the fall as a result of the impact. Next slide. So next we want to talk about MMDs, micromobility devices, and there's a few of them. This isn't your skateboard that you had when you were a kid, right? This is pretty massive. Next slide. Or maybe you're aware of the one wheel. So in any case, a micromobility is a device is a lighter, smaller, low speed device and can be motorized or human powered. It can be either shared, like rented, or privately owned. So, for example, electric scooters. Is it Lime? I think Lime is the company that rents them. You have a account on your phone. You scan the QR code. You rent it and you use it. And you start maybe at the train station and end at the hospital, and you just stop paying when you arrive at the hospital. It's pretty convenient, and the company has to worry about getting it back. Next slide. Or hoverboards. So depending on how old you are, you may remember the craze probably about 10 years ago at Christmas where everybody got one of these hoverboards. And then there was a lot of fires associated with them because of the charging of the hoverboards. But that's a pretty cool gift. But I'm a little older. Next slide. And I think of the hoverboard more like the original Back to the Future movie. Next slide. So hoverboard, if you haven't, I'm sure you've seen the movie. So that's what I was thinking about when I heard hoverboard. But hoverboard, just like flying cars, never materialized the way we thought. Um, the next slide. So perhaps the hoverboard is the one wheel. I see a guy a couple times a week in the morning coming to work. He's riding one of these things. He's got a light on the front, a clear light on the front, a light on the back of the device. He also has a light on the front and back of his helmet, and he's got some lighting on his vest. But he is flying when I see him, and it just scares the hell out of me. It's got to be so dangerous, but it must be quite exhilarating to ride. Next slide, please. So people who ride them say that they're unlike anything else you can ever ride, and they really enjoy it. Next slide, please. E-skateboards, they're pretty awesome, I guess, if that's what you want to do, but extreme. So how fast do you think an electronic skateboard can go? Well, I got to tell you, when you're riding an e-bike, um, 20 miles seem about an hour seem pretty fast. But when you're riding an e-skateboard, I can imagine that it must seem a lot faster. Do they go 20 or 30 miles? Well, they can go up to 62 miles an hour or 100 kilometers an hour. So they're very fast. Next slide. This gentleman, that doesn't look like a motorized skateboard to me, but he's in one of these wind suits, and it was nice of him to prepare properly and wear a seat collar while he's riding down the road, so that when he crashes, at least he's already got a seat collar in place. But we will need to cut all of that latex suit off of it. That helmet is very interesting. I think it does a good job protecting it, and I think that neck collar is part of the helmet. But at the same time, how does that limit his hearing? How does that limit his vision? Next slide, please. So the case study number two, um, this is someone that came to our ER, a 16-year-old male patient, fell from an e-skateboard. Patient was brought in by EMS to the ED after falling from an electronic skateboard. Um, Possible musculoskeletal trauma. He was in a lot of pain. Patient reports generalized body pain, worse in his back, his arms, his legs. There was no LOC, no head injury noted, no visible fractures, but he was reporting pain 10 on the 10 scale. Notes that he has similar pain episodes previously in Epic, and that although there was no external bleeding or deformity, next slide, he did have a history. He was known to have sickle cell disease. So he had multiple hospitalizations as a result of that, and he was known to have needed opioids for his pain in the past. So he's presenting to us a little bit of elevated heart rate, low blood pressure, actually. Everything else looks pretty normal. No bruising, swelling, deformities, nothing showing neurologically. Um, Mild yellow eyes present. Next slide. And note that his CBC 8.2, his blood count is elevated for the tests that are primarily to determine that he's got sickle cell. I'm not an expert on that, on the smears and all, but as far as trauma goes, he had no fractures or dislocations. He was treated for trauma initially, and the imaging ruled out any fractures or injuries, but his pain remains severe despite the findings of no injuries. So, on further analysis, excuse me, further review, it was recognized that this pain was probably his sickle cell triggered by the trauma and by the dehydration. Next slide. So we needed to control his pain with morphine. Sickle cell patients often don't get the pain medication they really need because, well, we know why in the ER we have a lot of people that would really like the pain medication that don't necessarily need it, or we feel like we're being pushed into it. But he needs pain medication. He needs to be hydrated. He needs oxygen, supplemental care, meaning warming his environment, blankets, warm area, reassuring him, and basically checking his vitals and his pain hourly. So his outcome was that his pain gradually improved over the next 2 to 3 days. There was no complications from trauma, and he was discharged 3 days later, following up with his physicians regarding his underlying condition. Next slide, please. So the things that we need to learn about in this case that pointed out is that always consider underlying conditions, even in severe trauma. It's not just the trauma, it's the patient. Any kind of patient that has pain out of proportion, don't necessarily think they're faking. They might be in a crisis. Swift recognition and avoiding unnecessary investigations and tests would have been helpful, and holistic care and giving him empathy are essential to chronic pain disorders. Next slide, please. So, before we move off of scooters, Keep in mind that probably one of the most dangerous things that we see are the second riders. And I mentioned about the children and how dangerous it is. Despite having a seat and despite having helmets, in this case, it's just a recipe for disaster, as I'm sure any reasonable nurse would agree. Next slide, please. So let's talk about e-bikes. So I know you're thinking about e-bikes, the e-bikes you see, the people delivering food using e-bikes, but keep in mind that they vary in how much power and how fast they can go. Next slide. So this is really not an e-bike. It's really an electronic motorcycle. And I think the emphasis or the reason for the law change in New Jersey was to try to control this type of a device that's or transportation device that's considered an e-bike, even though it goes much faster. Even regular e-bikes, like the e-bike that I have, is very heavy. If it starts to tip over, it's going to tip, and if it falls on you, it's going to do a lot of damage. They're heavier, they're faster. If you don't know how to use an e-bike, even the one that's the least powerful, you get hurt. You hit the throttle thinking it's going to go slow, and it takes off fast, and so you got to really be careful and practice a little bit before you go out on it. Um, Anything that's got a speed less than 20 miles an hour is considered uh, class one, I believe. We'll talk about that later, but we're worried about the ones that go faster. But that being said, falling off a bike at 20 miles an hour, you can do some serious damage to yourself. Next slide, please. So this patient wasn't brought to our hospital, but I know of the case because it happened locally, where there were two girls that were riding e-bikes, and they were killed by a person driving a pickup truck. That was my emphasis for this case. But an 18-year-old female not wearing a helmet is riding on a main road that has a 40-mile-an-hour speed limit, like a county 4-lane road through through towns in our area. There was another rider, a female peer of her, who also was on a bike and was pronounced dead on the scene. So EMS reports that her airway is intact, but she had a Glasgow Coma scale of 14. She was hemodynamically stable on arrival. The mechanism of injury was obvious: a high-speed impact, ejected. I don't know if you can be ejected from an e-bike, but you're certainly thrown off, and that she had head impact on her head hit the pavement. Next slide, please. So in this case, you may see a bike like this on the side of the road. Next slide. So the primary assessment by EMS, ABCDE approach, airway. Although she was bleeding from the lip, she had a patent airway, breathing, bilateral breath sounds, respiratory rate of 20, slight distress, circulation, heart rate a little fast, 110, blood pressure a little low, 198 or 98 over 65, depending on the size of this young lady. Her skin was cool and clammy. She was confused, is why she had a Glasgow Coma scale of 14. Her pupils were 3 millimeters, equal and reactive. She did have abrasions on her arms and her legs. I mentioned the laceration on her lip, but she also had a laceration on her scalp and a severely deformed left wrist. Next slide. So the head scalp secondary assessment, head laceration was noted, mild bleeding to that area. C-collar was applied by the pre-hospital team. Her chest showed no deformity and her breath sounds were equal. Her abdomen and pelvis were intact, soft, tender, but she did have a tender left lower quadrant, and she did but pelvic stability. Her extremities, as I mentioned, the left wrist was deformed, but she did have good neuro. Diagnosis: head CAT scan, small left temporal subdural hematoma, not wearing a helmet, right? X-ray left radius was fractured, and the fast exam was negative. Next slide. So management, well, initially monitoring, continual neuro checks, 2 IVs with warm fluids, give her pain medication, titrated to her comfort, the tetanus shot, the tetanus life-saving shot, irrigating her wounds, dressing her wounds. Neurosurgery was consulted because of the subdural bleed, and the wrist was immobilized for future treatment. Next slide. So nursing considerations. Um, Keep in mind that with a head injury, the airway can deteriorate quickly. You need to do frequent neuro assessments to make sure that doesn't change. Control her pain for pain management and psychological support. Keep in mind that you're also treating not just the patient's injuries, but their emotional state. Communicate with the family, particularly with since there was a fatality of the other rider. Imagine the emotional trauma related to that. And document the mechanism of injury, the timing of intervention. So the outcome after 48 hours, she was admitted for 40 hours for observation. No surgery was needed for the subdural. Um, she recovered fully with the wrist fracture after 6 weeks. Counseling for grief and trauma were provided, and she was educated on the safe use of helmets and riding e-bikes on the road. Next slide. So there's another type of device that we don't really talk about. How about the senior citizens using these things? Whether they're motorized, like the picture on the right, or maybe non-motorized ones, wheelchairs. But keep in mind that their maximum speed is about 10 miles an hour, so they are not considered a motorized vehicle. They're considered pedestrians. So interesting, when I was running the EMS for a hospital, we were in a building a block away, and I heard a tap on the glass of my first floor window, and there was a lady out there in one of these scooters, and she was saying, "I'm short of breath." So we pulled an ambulance out. We put her in the ambulance, put her on oxygen, took her the block to the hospital, the ER that I now run. And what the heck am we going to do with this thing? How are we going to make sure that she doesn't lose it? So I thought the easiest solution was to just jump on and ride it over to the ER, which is what I did. And it wasn't as easy as I thought, and it went faster than I thought. But that was my experience with these things. Next slide. So what counts as a personal transportation device, a PTD? E-bikes do, and keep in mind that those that are pedal assisted, like mine, where you got to pedal, you or you could use the throttle, but for the most part, the battery won't last very long if you're using all throttle. So you usually pedal assisted, but under 20 miles an hour versus over 20 miles an hour is a classification for the bike. Also, e-scooters, motorized, and keep in mind that some of them are rental as opposed to personal. The micromobility devices, remember the hoverboards, the one wheels, the e-skates, e-skateboards. They're all considered personal transportation devices, commonly used by teenagers, young adults, maybe those that are undocumented, because up till now you didn't need a license, delivery workers, as well as commuters that are looking to avoid the gas costs, avoid the vehicle costs, but also avoid the parking problems. Speed, an e-bike could range from 10 to 20, but could go much faster, 30 miles an hour, even um, faster. And so can those scooters, as well as the electronic skateboards. Next slide, please. So why do we need to be prepared as emergency nurses? Well, we need to know about what happens with these e-bike accidents. The e-bikes can weigh from 55 pounds to more than 90 pounds. They're very heavy. Um, Keep in mind that if you have an e-bike, and just don't fall off an e-bike or e-scooter, but if you're hit by a car or hit a car, that's going to cause severe injury. It's important to understand that. The mechanism of injury is often unclear due to poor recall of the incident. They don't remember what happened. Um, in my experience, many of the people that ride e-bikes, especially at night, may be intoxicated. And although injuries, patients arrive oftentimes as walk-ins, not ambulance arrival, the ED nurse should not be tricked by thinking that it's not a significant injury. Maintain a very high level of suspicion for a significant injury. Next slide, please. So common injuries that we should be looking for, of course, the head and facial injuries because they're not wearing helmets. Also keep in mind concussions, they don't remember the events, facial fractures, and dental. Look at the teeth, upper extremities, especially with the scooters and the bikes. They're looking to break their fall. As a result, they break their fall all right by breaking their wrist or their forearm. Also, shoulder dislocations as a result of that stiff arm hitting the ground, knocking the shoulder or the clavicle, causing fractures. Lower extremity fractures, hit the bumper of a car, or try to put your foot down to stop falling, have a tib fib fracture, ankle sprains, and the avulsions as of going at high speed and then suddenly sliding down the road. Keep in mind that their thoracic and abdominal injuries could cause rib fractures, pneumothorax. The liver and spleen are specifically in danger when you're hit by a motor vehicle. Next slide, please. So during triage, some of the red flags you want to look for, um, thinking that it's a low speed injury because it was only going 15 or 20 miles an hour. But keep in mind that it's falling from an e-scooter. It's not being in a vehicle. Anytime that an e-bike or e-scooter hits a car or hits a hard surface, um, that's a red flag for injury. Clearly not having a helmet, but think about wearing the wrong helmet. So if somebody is on a bicycle that goes 10 miles an hour, they have a bike helmet. Somebody that's on an e-bike that's going 25 miles an hour wearing a bike helmet, that's like not wearing any helmet. They'll have a traumatic brain injury. Keep in mind that they might have a loss of consciousness or amnesia and not remember the incident. And then also think when they have chest pain or a chest injury that they might have a pneumothorax or they could have a rib fracture. Next slide, please. So more of a practical issue. This is a bike that was actually something that I came across on Monday morning in my ER. It says the sign on the seat, patient admitted to the hospital, do not touch. You see those pink stickers on the sign, that's the patient sticker with their MR number. So I was able to figure out whose bike it was. The reason, you notice the chain there and the lock, but the lock does not close, it doesn't lock, so we couldn't put it on the bike rack outside. So what do I do with this? Honestly, I don't know. I mean, I've run into issues where bikes are damaged, and one guy, he had an e-bike and he was arrested and he was in jail for a long period of time. Um, we ended up throwing away his e-bike because it was in bad shape. When he got out of jail, he came looking for it. So what do we do with these e-bikes, e-scooters, and MMDs, especially when they're damaged, especially when they have batteries that are damaged? What do we do? Next slide. Well, I don't really know. I don't have a good answer, but let's think about it. Are is a bike an e-bike or something with a battery or something with a motor safe in the ambulance bay? No. Will the police department take them? Well, it depends on what town you work in, but not in my town. They got other more important things to do. They're not interested in e-bikes or bicycles. Is there a way to lock them on the bike rack? Well, typically I will put them on the bike rack. if I can't figure out whose bike it is, or if it's got a sticker and I can't get a hold of them for 2 or 3 days, I'll put it out on the bike rack with the hope that the correct person actually gets their bike. But the bikes seem to disappear, so it's out of my not my problem anymore. We'll put a patient sticker on the bike. That's great for the staff to do, so at least we can try to get it back to them. What if we have a damaged e-bike with a battery? Do we call the fire department? That probably be the prudent thing to do. But put the bike outside and then call the fire department. I don't know that they're really going to be helpful though. You probably end up putting it in the dumpster because you can't hang around. And you can alert security for the hospital, but I don't know how helpful they'll be, but at least there'll be a record that you tried to secure the property. Next slide. So let's talk about the New Jersey e-bike law. Well, since 2019, there's been a law in New Jersey about low-speed electronic bicycles, described as 2 or 3 wheel bicycles that are fully operable by pedals, but have an electric motor of 750 watts or less. And the maximum speed that they should be able to go is 20 miles an hour. Next slide, please. However, e-scooters don't really have a law, and they can reach 19 miles an hour easily, probably a lot more now. They can park on the sidewalks. They're not supposed to block pedestrians, but they're allowed to. They're riding on the sidewalks, depending on what municipality you are, may be permitted. They don't require any license, insurance, or registration, and must follow the laws that a bicycle does. That somebody wearing if they're under after 17, they're supposed to be wearing a helmet. I don't know about your experience, but mine is I don't see many kids wearing helmets. Motorized scooters, they're vehicles with motors that not manufactured to comply with federal motor vehicle safety standards and not allowed on public roads or sidewalks or public lands. Examples include motorized skateboards, hoverboards, pocket bikes, and super pocket bikes. Well, I'm not really clear on the difference between a pocket bike and a super pocket bike, but at the same time, they're motorized and they're not really controlled. Next slide. So the laws were really based on what type of vehicle, how fast it went, what type of engine it had. But for the most part, you didn't have to have a registration or insurance or a license in order to operate them. Next slide. Class 1 was a vehicle that went less than 20 miles an hour. Class 2 was that had a throttle and went more than 20 miles an hour. And then Class 3, now in 2026, face registration and insurance. And what I've recently figured out is Class 1 and Class 2 also require license and registration. It's just that Class 3 require insurance. And this is a new law that's been passed. The helmets are now required for all riders, and we're supposed to ride on the road with the traffic like a vehicle, not on the sidewalks or not opposing the traffic. Next slide. So the big law change happened when Governor Murphy was leaving office. His last day of office on January 21st, he signed this controversial bill, which requires registration and insurance and licensing and for e-bikes. Next slide. So the law went into effect January 16th with a 6 month uh, initiation. So as a result, July 16th, which is coming up in 8 days, is the day when all this takes effect. Next slide. So if this looks a little confusing, that's because it is very confusing. I don't think anybody really understands the laws just yet, and I didn't initially understand it and may not still understand it. Next slide. I didn't really understand that I was going to have to register my e-bike. I thought because it was, pedal assist that I wouldn't have to, but there's a new law in town, and nobody really knows what's going on. Next slide. So as a result of this law, Senate Bill 4834, Assembly 6235, that passed and is to go into effect next week. You must be 15 years old or older to have a e-bike, and you must have a moped license. I'll talk about how to get an e-bike license, a moped, if it's even an e-bike license, which is very confusing. Registration is required for motor vehicles for all these vehicles, but it's only been like the last 3 weeks that supposedly they even have the ability to register them. Insurance for e-bikes that go faster than 20 miles an hour, but the insurance companies don't have policies to buy. Helmets are required for all riders, but it doesn't specify what type of helmet. And riders must be in full compliance with this license and insurance by July. I thought it was 16th. This document I got it from showed the 19th. 16th, 19th. What's a couple days amongst friends? Next slide. So the way I see it, there's no clear way yet to register your e-bike. There's no insurance available. And in order for a 15-year-old to get a license, they must get a permit, do an eye exam, pass a written exam, and then they have 45 days of practice to pass the road test. How does a 15-year-old practice? Now, when I got my motorcycle license, you're supposed to practice once you got your permit with somebody that was licensed, but there's no requirement for that. So, that's a lot for a 15-year-old to do all that stuff. Next slide, please. So, I don't know how these laws are going to be enforced, but let's talk about helmets. So here's a guy with a pretty aggressive looking scooter and a very impressive helmet. Um, the helmet is the most important piece of equipment due to the high speeds of vehicle. A bicycle helmet is, as I mentioned, is inadequate. But at the same time, he's wearing a motorcycle helmet. I would think that's much too heavy, and you need the mobility to look around a lot more, and also to hear your environment. Next slide. So I propose a helmet, not for like a motorcycle that's doing 65 to 75 miles an hour, and not for a bike that's supposed to be doing 10 miles an hour, but an e-bike helmet that's meant to do 20 miles an hour. So you need full face coverage, full head coverage, but your ears need to be exposed so you can hear what's going on around you. Your eyes need to be protected. A lot of facial injuries from these accidents, particularly protect your eyes. But it's going to need to be lightweight so you can turn your head easily. Hey, think about it in more in terms of like a ski helmet. I think that'd be a better option for us. Is that too much to ask for to have the right helmet? Well, maybe it is because the e-bikes, you could buy an e-bike for a couple $100 online, although you're not supposed to be able to buy an e-bike online now in New Jersey for the next year, to try to encourage people to buy them from stores and learn about the registration and insurance. But e-scooters, you can get an e-scooter for 120 to $150. Um, so maybe buying a $200 helmet when the device only costs 100 to $150 is asking too much. Next slide, please. So let's talk about hospital employees using their e-bikes and micromobility devices. So, I mean, I'm thinking more in terms of this picture on the right-hand side, where we have a nice setup for e-bike charging and a controlled environment, as opposed to look what I found on the internet, the bike hospital. Well, I guess that's the hospital, not for patients, but for the bikes. But imagine a parking lot full of bikes like that. Um, it's fun what you can find on the internet. Next slide, please. But we have our employees using e-bikes, e-scooters, and personal transportation devices. And are they being safe? this guy looks pretty good, but we need to talk about it. We need to think about it. Next slide. So there's a huge benefit to our employees. It's convenient for them. They have faster commute times. They reduce their dependency and expenses on cars. They're not paying for parking. They're not late for work because they're trying to park. The hospital could be promoting them being healthy and having well-being and more physical activity, reduce their stress, and save them money by no fuel, no cost of parking, and not using mass transit, which can be expensive. Next slide. Suggests and support incentives for hospitals to have for people to use e-bikes. So we could provide parking for them. We could provide charging stations outside and secure. So we don't want people to bring in their batteries in the hospital and charging them. That's a fire risk. But at the same time, we need to be able to charge their bikes so they can get home. Um, when I brought this to my hospital and talked about having showers and then lockers big enough for their helmets to fit in, they're like, okay, that's where you lost me. We were okay with like good places to park and maybe charging, but having them shower and have lockers for them large enough for their helmets is asking too much. Do we provide safety training for staff? And can we provide an incentive for them to reduce their car use? That would be a huge benefit to the hospital. Next slide. So the hospital would be a good guy, a good employer by reducing the carbon footprint, by providing a green initiative, by reducing parking needs for employees. That might help actual employees be more punctual, and then to position the hospital to be employee centric and encourage healthy habits. Next slide. Obviously, there's risks to the hospital. Safety, like what if we're having accidents with these e-bikes and e-scooters, particularly hitting pedestrians on campus? What if people are speeding around campus, scaring people and injuring them? What's the liability that the hospital has if an employee has an accident commuting to work or on the hospital property? And then with regard to storage, I mentioned the battery concerns, but what if the bikes are and equipment are getting stolen? Where's the hospital liability there? And what about the employees that don't follow the rules? Next slide. So we need to have hospital rules, possibly not allowed to ride on the campus more than 6 miles an hour, not allowed to ride at all in pedestrian areas. Um, if you have your wheels, you got to walk them. And then parking only on hospital bike racks, not like all over the hospital to every drain pipe or fire hydrant. No batteries allowed inside, no vehicles allowed inside, and only charging in approved outdoor stations. Next slide. As you've heard and as you know, the lithium ion batteries pose a significant risk for fire, particularly if they're charged with the wrong chargers or the batteries are damaged. So we must use manufacturer approved chargers meant for that battery. And once again, no indoor charging and no charging near flammable materials. And what's flammable materials? Like cars that have gasoline in them? I don't know. Next slide. In conclusion, e-bikes, e-scooters, and MMDs can be beneficial to the community as well as the hospital staff if used safely. The ED nurses need to be prepared to encounter patients who have injuries that are more serious than expected when they're using these devices. And storage of patient and employee vehicles must be done in a safe way and consideration for battery standard hazards. Next slide. So that's my references, and there's another set of references. Another next slide. All right, and that should be it.
Excellent, Rod. Thank you very, very much. Great information there. So now you can feel free if you want to unmute yourself. There's no comments or questions in the chat box. But if anybody have any questions, I'd almost like to hear from some of you that are out in a variety of different hospitals. I know we've got a couple people on that are kind of in suburban hospitals and less off the urban path as to what you're seeing both from the standpoint of micro mobility related injuries and even and I think it's a great slant that you put on it, Rod, of the employees that are writing these things in now and what are the implications there? I mean, we've had at least one of our staff that was a patient in our trauma bay because they got hit coming into work on their e-bike. So, I mean, there are a lot of ramifications that are there. So, I don't know, anybody have any comments, questions, or anything? Stone cold silence. And that's okay if you don't. Um, I mean, good information here, and particularly interesting information. And again, I don't think any of us on this call tonight, if you haven't seen a micro mobility related injury come into your department, it's probably you just haven't looked deep enough. You've probably had somebody that came in and told you they fell off a bicycle or fell off a scooter, when in reality it might have been an e-bike or an e-scooter. So good
Well, I
stuff.
will tell you this, I have not registered my e-bike, and I really don't know if I'm going to.
Yeah,
Um, Honestly, I don't know. I don't know how what would happen if I went to motor vehicles to try to register it. But yeah, I think that's gonna. I don't know that that's really gonna change anything, but I think it's just gonna really harass the people that need to use them the most. As far as traumatic injuries, I guess maybe when patients do come in, there'll be a police report done. That's part of the laws, and we would be able to. We will need to do a better job of documenting what type of device the patient client got injured using.
absolutely. Melanie, you get your hand raised. Go ahead and come online and ask your question.
I just wanted to share. I used to work in the city, New York City, and we had we had quite a few injuries on the e-bikes, and a lot of them were burn patients or severely burned patients. So the hospital that I worked at, which was a big healthcare system there, actually banned them from use, and they were not allowed on any of the campuses because of the dangers of the batteries exploding. So
Yeah.
it's very, very dangerous.
Yeah, and as Rod said at the beginning, I mean, a lot of times people were buying these bikes online from China. So the stuff that was coming in from China, the batteries they were using, the charging they were using, were causing all kinds of issues. Particularly for the city, if you watch the news at night, particularly up here in the northern part or the central part of the state, where we get the New York feed, and I'm sure it is for those of you south that get the Philly feed. The fire departments are constantly running fires, not for vehicles, although that happens, but for these e-bikes that are kind of igniting, if you will, while they're on charging, for a variety of different reasons. So definitely got it there. Had another comment that yeah, in Hamilton, seeing more accidents from these bikes. Absolutely, you are. I think one of the problems, and Rod and I were talking about this before some of you climbed on tonight, was there's been no coding available for it. So if you're in Epic or if you're in Cerner and you're doing electronic charting, there's not even necessarily a drop down that allows you to differentiate for an e-bike or an e-scooter from a bicycle or a scooter. We at Joe's at our trauma center, we still do paper flow sheets in our trauma bay, which I still say is the best way to go. Thank you for not making us go electronic yet. But we actually, as are revising those sheets, we're putting e-bikes and e-scooters, and we're mounting an awareness campaign for all of our trauma nurses and emergency nurses on asking and getting more information on the type of device that they were riding on, and not take it for face value that if they say it was a bicycle, that it was just a standard run-of-the-mill pedal bicycle. So and we have seen at our particular shop an exponential increase in serious injuries that are coming in post COVID, in particular, when these bikes started taking off or these devices started taking off. And over the 2021, 2022, we were seeing increases, and the injuries were there. But starting in about 2023 and until last year, where we saw our first fatalities, that were coming in from e-bike related incidents. And then this year we've had already probably close to about 3 or 4 fatalities. And we're only halfway through the year with, I think, a doubling of the number of micromobility incidents for this time span compared to last year. So we may actually end up seeing a quadrupling in the number of incidents that happen. The laws that are out there, I think, are going to be interesting. Again, there's like any motor vehicle laws, they're going to be up to the discretion of law enforcement officials and how they handle them. And I'm sure they're going to keep it pretty low key to begin with. And maybe helmets and mandatory helmets will provide some help when it comes to head injuries, but we're seeing a lot of thoracoabdominal injuries, extremity injuries, pelvis injuries. Remember, you're out on the streets with a car, and just like on a motorcycle, you're getting T-boned, or you're running into cars, or you're running into posts, or you're hitting curbs. So there's a lot of injury patterns that you need to be mindful of. And it is truly a multi-trauma situation with a lot of these patients, particularly when they're going greater than about 10, 15, 20 miles per hour. If you're familiar with the new trauma triage guidelines that are out there, they're not so new now, but they came out in 2021, and they were developed really prior to the scourge of micromobility devices out there. Is they look at any kind of a motorized device that's traveling at a significant rate of speed. So they've gotten away from the old 20-mile-an-hour litmus test for motor vehicles and for motorcycles, and it's now any kind of a device, including ATVs, and you can even insert e-bikes and micromobility devices in there where there's a significant speed involved, and that significant is really in the eye of the beholder, whether you're a pre-hospital clinician or you're doing triage in the hospital when they come in. So a lot of stuff to be thinking about out there for sure. So keep your eye on stuff. We'll see how things are going. We're going to start a multi-institutional study here in probably about 2 or 3 months. Most of the trauma centers, if not all the trauma centers, are getting on board sharing data on pre and post implementation of the law, and whether or not we're seeing less injuries coming in and severity of injuries coming in. And quite honestly, I've got a little predictor out there, and I'll put this out there now. And Rod, you kind of can help me kind of monitor from your end. But e-scooters were not included in this legislation, so it's going to be interesting to see if people start moving away from the e-bikes because of the ramifications of licensure and registration and insurance, and start moving to the scooters, and we'll see more e-scooter related injuries coming in. We still see a lot of them now, honestly, but I wonder if we're going to see an increase in them with people shifting away from an e-bike to an e-scooter to skirt away from the laws. I don't know. Time will only tell, right?
I think you're right, and especially because the e-scooters are a lot less expensive as well.
Exactly. So, all right. So we're coming down to the end of our time here. So I'm going to put in the chat box a link, and then I'm going to scroll over here to the next for a QR code. So you can either QR code this with your camera, or you can click on the link in the chat box. That'll take you to a Survey Monkey evaluation. You can tell us how Rod did tonight. I think he did an excellent job personally. But evaluate tonight. Give us some information with regards to additional topics you would like to see as we move forward. Also, if you're interested in presenting a topic, let me know. I think most of you on this call tonight have been to a topic session in the past, but if you haven't, and you want to get on our email list, and I don't send a flurry of emails, it's an occasional email just to remind you of our next upcoming session of either topics in trauma nursing or the Trauma Nursing Journal Club, which is a companion podcast that I do. Then definitely put your information in the evaluation form, and I will add you to my ever-growing email sheet for that. Again, if you're online watching this, the CE credit was only available for those that were live tonight on July 8th. So what I'm going to do for anyone who's online is this is the online, or your ability to claim credit is going to go bye-bye probably about this time tomorrow. I'll shut it down about the time that I post this and render it online, so people online don't try to claim credit. And then I will be emailing all of you certificates. Those of you that do the evaluations, I'll email you certificates over the next day or so. So you'll have a certificate suitable for framing, as I like to say. All right. And then my last shameless plug again is YouTube channel. This will be posted on YouTube. I will send everybody a link to YouTube, and you'll be able to share this information even within your departments. Hopefully, again, this strikes a chord with you if it hasn't already been something on your radar screen, and you can pass this information on to some of your colleagues. And if you tell two people and they tell people, you know how it goes. We can get the word out there about what's going on. So. Rod, thank you so much for your time tonight. Thank you for your expertise. Everybody
Thanks
else,
for inviting me.
definitely thank you for absolutely. Thank you guys all for your time tonight, and we will see you on the next episode of Topics in Trauma Nursing.